welcome on Learning with L and R, and today we are going to discuss about the new topic, that is newborn care. First of all, we have to discuss about the profile of the newborn and characteristics of the newborn. What is that? Newborns may look alike, but each has their own physical attributes and personalities. It totally depends upon the parents' physique and the traits of the parents. Some newborns are fat and short while some are long and thin. The weight of the newborns varies according to their race, genetics and nutritional factors. Weight. The average weight of a newborn, full-term newborn, is about 2.9 kg with the variation of 2.5 to 3.9 kg or more. The weight is very variable from country to country. The newborn loses 5% to 10% of its birth weight during the first week of life, then regains the birth weight by 10th day and gain weight rapidly afterward. Why the newborn lost their weight 5 to 10%? Because when the newborn try to adjust in the extrauterine environment, in that condition the weight is going to lose, and after 10th day they have adjust very in a good way. That's why the day by day the weight going to start gain. Then the baby continues to gain weight about 20 to 30 gram per day for next 3 months of age. Length. At birth, the average crown heel length of the term infant is 50 cm with the range of 48 to 53 cm. It totally depends upon the parent's physique. Head circumference. The head circumference usually varies from 33 to 37 cm with the average of 35 cm. The chest circumference is a mature newborn is 2 cm less than the head circumference. Then the chest circumference is measured at the level of the nipple using a tape measure. The chest is rounded rather than flattened anterior-posteriorly. Skin is pinkish but bluish hand and feet. It is also known as acrocynosis. It may be covered with vernix sesosa, milia and lanugo hair, especially at back. Ear cartilage is firm and fully covered, showing good elastic recoil. External auditory canal is relatively short and straight. Eardrum is thick and eustachian tube is short and broad. Eyes are largely covered with eyelids. Breast nodules is palpable, measured over 5 mm in diameter. Abdomen prominent with short neck and large head. Then the trunk is relatively larger and the extremities are short. Kidney, liver and spleen may be palpable. Scrotum in male. It shows palpable testes and shows adequate rugae with deep pigmentation. Genitalia in females, the labia majora covered, the labia minora and the clitoris. Then foot, prominent deep creases are present. Vital signs. Vital statistics. Parameter. Weight 2.9 kg to 3 kg. We usually said 2.5 kg to 3.5 kg. Length 50 cm or 48 to 50 cm. Head circumference 33 to 35 cm. Chest circumference 31 to 33 cm. And it less than 2 cm than the head. Abdominal circumference 31 to 33 cm. Then the vital signs. If we talk about temperature, then the normal range of temperature is 36.5 to 37.2 or 37.5 degrees Celsius. Pulse 120 to 140 beat per minute. Respiration 30 to 50 beats per breath per minute, and blood pressure 100 to 50 mm of Hg. Adjustment to extrauterine life. The newborn's color on the first 15 to 30 minutes of life is still acrocynotic, and after 2 to 6 hours there are quick color changes that may occur with movement or crying. The temperature within the first 15 to 30 minutes after birth falls from the intrauterine temperature of 100.6 degree Fahrenheit or 38.1 degrees Celsius, then stabilizes at 37.6 degrees Celsius after 2 to 6 hours. The rapid heart rate of a newborn is as much as 180 beats per minute on the first 15 to 30 minutes of life. Will have wide swings in rate with activity as it slows to 120 to 140 beats per minute. Then the newborn's respirations are irregular in the first few minutes of life, then slows to 30 to 60 breaths per minute after 30 minutes and will become irregular again only during the activity. The newborn would be alert in the first 15 to 30 minutes of life and later on will alternate between the sleeping and awakening phases. A neonate spends about 20 hours a day in sleeping. Then the energy requirement initially is 55 calories per kg per day, which increases to about 120 calories per kg per day at the end of the first week of age. The bowel sounds can be heard after the first 15 minutes of life and becomes present afterward. The normal blood volume of neonate is about 80 ml per kg of body weight with RBC 6 to 8 million. HB percentage 18 gram percentage, WBC 10,000 to 17,000 per cmm, platelets 3.5 lakh. Then assessment of the newborn. The period from birth to 28 days of life is called neonatal period, and the infant in this period is termed as neonate or newborn baby. The first week of life is known as early neonatal period, and the late neonatal period extends from 7 to 28 days of age. The healthy newborn infant born at term between 38 to 42 weeks of life cries immediately after birth, establishes independent rhythmic respiration, quickly adapts with the extrauterine environment, having an average birth weight and no congenital anomalies. Assessment of the newborn as soon as possible after birth are vital responsibility of the nurses working in the hospital or in the community. The assessment should include detailed history of prenatal and intranatal period and genetic history of family along with the head to foot examination and review of maternal investigation. Then the purpose of initial assessment are mainly to assess the need for resuscitation, to ascertain the gestational age, to detect presence of any congenital anomalies or any disorders which may affect the well-being of the baby. It should be done at the place of birth by the trained personnel immediately after delivery of the neonate. Then the assessment in the postnatal period. Postnatal period is that period when baby is born, and after that we provide the care to the baby. That is the postnatal period. Should be done at least for 3 times. First postnatal assessment should be done within 24 hours, second assessment within 2 weeks of age, and third assessment within 4 to 6 weeks of age of baby. In home delivery, the first postnatal assessment should be done within 3 days and the others are same as institutional delivery. Then the initial assessment of the neonate is a very important activity immediately after birth, because we have to detect something that is inappropriate to the child. That's why the immediate assessment is very significant for the child. The most essential assessment is the first cry. Good cry helps in establishment of satisfactory breathing. The respiration, heart rate and skin color are the basic criteria which should be evaluated immediately to determine the need for life-saving support. Another significant assessment of the neonate is ABGAR scoring, as described Dr. Virginia ABGAR. And here we can assess the respiration, heart rate, muscle tone, reflex response and skin color. And if these things are absent, like respiration is absent, heart rate absent, then muscle tone flaccid, reflexes response nothing, then skin color blue or pale, then we give the 0 point to the child. And there is a total 3.0, 1 and 2. And in 1, what we do in respiration, if respiration is slow, then we provide 1. Heart rate less than 100, some flexion of the extremities are there in muscle tone, and grimace, reflexes response, body pink but extremity is blue. That time we give only 1 point each according to the criteria. And if in respiration cry is good and heart rate more than 100, muscle tone active movements are there, reflexes reflexes response, the good cry are there, and skin color completely pink, then we provide 2 point in 5 criteria. And the total score is 10, because there is the highest number is 2 and there is a 5 things we have to observe, that is respiration, heart rate, muscle tone, reflexes response and skin color, and 2 by 5 is equal to 10. That's why the total score is 10. Then if the score between 7 to 10, then it is okay, no depression are there. and if the score is 4 to 6, then mild depression is there. If the score is 0 to 3, then severe depression. Here we have to provide the neonatal resuscitation to the child. That's why the immediate assessment are life-saving for the child. Assessment should be done in a comfortable warm room with good light, and the color of the wall of that particular room, not blue or not pink color. Do not use the pink or blue color, because if the pink shade blue or yellow, if the yellow shade put on the yellow reflection put on the child, then we think that might be child suffering from jaundice, or if blue, then it shows the cyanosis. Then assessment should be done in a comfortable warm room, because the temperature maintenance is very important in child care, and the good lights should be there. Safety measures should be followed, especially about prevention of infection. All information should be recorded immediately. If possible, mother should be allowed to be along with baby to promote bonding process. It is also known as rooming in. Then vital sign, I think we have discussed earlier. This is also done. Then assessment of gestational assessment at birth. Physical characteristics and term baby. Term or preterm baby, we have to differentiate. Hair texture and distribution on scalp. The hair should be silky, black, coarse, and individual strands. Skin texture and opacity, pink, scanty lanigo, and only large veins are seen. Good elasticity and turgor. Breast nodule and nipple formation more than 10 mm diameter. Breast tissue and nipple raised above skin level. Ear cartilage, pinna is firm with definite cartilage and instant recoil. Then plantar creases, genitalia in male, entire sole covered with deep creases. At least one testis descends in the scrotum, prominent rugae, and deep pigmentation. Genitalia female, labia majora completely cover the labia minora and clitoris. Then physical examination. A complete physical exam is an important part of a newborn care. The healthcare provider checks each body system is carefully for health and normal function. The provider also looks for any signs of illness or birth defects. Physical examination of a newborn often includes first of all, when we start the physical examination, we have to check the general appearance of the child, and what we have checked in that: physical activity, muscle tone, posture, and level of consciousness. Then skin. The skin color, texture, nails, and any rashes. Head and neck. This look at the shape of the head and soft spots, that is also known as fontanelles, anterior fontanelles and posterior fontanelles on the baby's skull, and the bones across the upper chest, clavicles. Then face. This looks at the eyes, ears, nose, and cheeks. Mouth. This looks at the roof of the mouth, cleft palate, cleft lip, and the tongue and throat. Lungs. This looks at the sounds the baby makes when he or she breathes. This also looks at the breathing pattern. Heart sounds and pulses in the groin. Femoral pulses should be checked. Then abdomen. This looks for any masses or hernias. Genitals and anus. This checks that the baby has open passages for urine or stool. Arms and legs. This checks the baby's movement and development. Then care of newborn baby. Newborns undergo profound physiological changes at the moment of birth, as they are released from a warm, snug, dark, liquid-filled environment that has met all of their basic needs into a chilly, unbounded, brightly lit, gravity-based outside world. The immediate care that a child needs is essential care of the newborn. Normal, healthy neonates can be best provided by the mothers under supervision of a nursing personnel or basic primary health care providers. Then, about 80% of the newborn babies require minimal care. The normal term babies should be kept with their mothers rather than in separate nursery. Rooming in promotes better emotional bondage and establishes breastfeeding as easily. Nursing care of the healthy newborn baby after birth should be provided as immediate care of neonate and daily routine care. Then establish respiration and maintain clean airway. The most important need for the newborn immediately after birth is a clear airway to enable the newborn to breathe effectively. Since the placenta has ceased to function as an organ of gas exchange, it is in the maintenance of adequate oxygen supply through effective respiration that the survival of the normal newborn greatly depends. Wipe mouth and nose of secretions after delivery of the head. When we going to comes out the secretion from the baby mouth or nose, in first step we have to remove the secretion from the mouth and then the nose. Why? If we try to remove the secretions from the nose first, then the secretion in the mouth, the child might be aspirate. That's why M before N. Mouth secretion clean before the nose. M before N. Then suction secretion from the mouth and nose. Compress bulb syringe before inserting suction mouth first, then the nose. Insert bulb syringe in one side of the mouth. A crying infant is a breathing infant. Stimulate the baby to cry if baby does not cry spontaneously or if the cry is weak. Do not slap the buttocks, rather rub the soles of the feet. Stimulate to cry after secretions are removed. The normal infant cry is loud and husky, and observe the following abnormal cry. If the high pitch cry is there, then it indicates hypoglycemia. Weak cry might be prematurity, hoarse cry, laryngeal stridor. Keep the ears patent, remove mucus and other particles that may cause obstructions, because newborns are obligatory nose breathers until they are about 3 weeks old. Then warmth is very important for the newborn, because most of the newborn die only because of hypothermia. That's why the warmth is much important than anything else. Warmth is provided by keeping the baby dry and wrapping the baby with adequate clothing in 2 layers. Ensures head and extremities are well covered, because baby loses heat through evaporation, radiation, conduction and through convection. Then baby should be kept by the side of the mother so that the mother's body temperature can keep the baby warm. Baby can be placed in skin-to-skin contact with mother to maintain temperature of infant and facilitate breathing. Ambient atmospheric temperature to be kept warm adequately. It should be 28 to 32 degrees Celsius, and if the temperature falls below 25 degrees Celsius, then the baby should be kept under incubator to maintain the normal temperature of the baby. Then skin care. The baby must be cleaned of blood, mucus, meconium by gentle wiping before he or she is presented to the mother. During hospital stay, no bath should be given to the infant and does not reduce the incidence of neonatal infections. No vigorous attempts should be made to remove the vernix sezosa, as it provides protection to the delicate skin of the child. Each baby should have own separate clothing and articles for care to prevent cross-infection. Then care of the umbilical cord. The umbilical cord is cut about 2 to 34 centimeter from the navel with aseptic precautions during delivery and tied with sterile cotton thread or disposable plastic clip. The cord must be inspected afterwards for bleeding. The cord cut must be 2 to 3 centimeter, not 34 centimeter. Okay, sorry for this. Sterile cotton thread or disposable plastic clip. The cord must be inspected afterwards for bleeding, which commonly occurs due to shrinkage of cord and losing the ligature. No dressing should be applied and the cord should be kept open and dry. Normally it falls off after 5 to 10 days of life of the baby, but may take longer, especially when infected. And in this in umbilical cord, we have to observe the two things. There is a 2 arteries and 1 vein, and if the 1 artery is less, only 1 artery and 1 vein is present, then the child must be suffering from the chromosomal abnormalities. After that, care of the eyes. Eyes should be cleaned at birth and once every day using sterile cotton swabs soaked in sterile water or normal saline. Each eye should be cleaned using a separate swab. The eyes should be observed for redness, sticky discharge or excessive tearing for early detection of problems and prompt management. Then, vitamin K administration. Shortly after birth, vitamin K is administered as a single IM dose of 0.5 to 1 mg to prevent hemorrhagic disease of the newborn, also called vitamin K deficiency bleeding. Normally, vitamin K is synthesized by the intestinal flora. However, because the infant's intestine is sterile at birth, and because breast milk contains low level of vitamin K, the supply is inadequate for at least first 3 to 4 days. The major function of vitamin K is to catalyze the synthesis of prothrombin in the liver, which is needed for blood clotting. Then hepatitis B vaccine administration. To decrease the incidence of hepatitis B viruses is in children and its serious consequences, cirrhosis and liver cancer in adulthood, the first of 3 doses of hepatitis B vaccine is recommended soon after birth and before hospital discharge for all newborn. Then breastfeeding. The baby should be put to the mother's breast within half an hour of the birth or as soon as possible the mother has recovered from the exertion of labor. All babies should invariably receive the colostrums during first 3 days of life. Mothers should be informed about the importance and technique of breastfeeding. Initially, the feeding should be given in short interval of 1 to 2 hours and then every 2 hours. Nurses should assist the mothers to feed her baby adequately for the maintenance of hydration and optimum nutrition. Exclusive breastfeeding procedures should be explained to the mother and family members. If a vaginal delivery is there, then the feeding is start after half an hour to 1 hour. Then if a cesarean section is there, then feeding should be start at least after 4 hours of the birth. Then protection from infection and injury. The most important practice for preventing cross-infection is through hand washing of all the individuals involved in the infant care. Also the visitor who visit to the child, they also comes to the area, that particular area, after hand washing. Other safety measures are practiced, particularly in terms of proper identification and screening tests are used to detect various disorders. Then routine care of the newborn. The newborn baby should be kept with the mother for continuous mothering in hospital or in home in a well-ventilated room. Baby should be handled with gentle approach after proper hand washing. No infected person should take place or touch the baby. Baby should be allowed to sleep in supine position, which can prevent sudden infant breath syndrome. General cleanliness to be maintained and surrounding to be kept clean. Mother should be taught about art of mothering and to provide stimulation of touch and sound of the baby. Observation. The baby should be thoroughly observed twice daily for early detection of any abnormality. Temperature, pulse, heart rate, respiration, feeding behaviors, stool, urine, and sleeping pattern should be assessed. Mouth, eyes, cord, and skin should be looked for any infection. Daily routine observation is essential to detect the presence of danger signs for early interventions. Then, weight recording. The average daily weight in healthy term babies is about 30 grams per day in the first month of life. It is about 20 grams per day in the second month and 10 grams per day afterwards. During the first years of life, most infants double their body weight by 4 to 5 months, but in the first week of life, there is a physiological loss of body weight due to removal of vernix, mucus, blood passing of meconium, and reduction of extracellular blood volume. With breastfeeding, majority of the babies regain the weight within 7 to 10 days. Immunization. In institutional delivery, all neonates should be immunized with BCG vaccine, which prevent from tuberculosis, and it is 0 dose of BCG and OPV. Oral polio vaccination, which prevent from poliomyelitis. Hepatitis B, which prevent from hepatitis. Vaccine can be administered at birth as first dose and other 2 doses in 1 month and 6 months of age. Mothers should be informed about the recommended national immunization schedule and explanation to be given about importance of complete immunization and all possible reactions following vaccinations, especially about BCG vaccination. Follow up and advice. Each infant should be followed up at least once every month for first 3 months and subsequently 3 months intervals till 1 year of age. Follow up is necessary for assessment of growth and development, early detection and management of health problems. Health advice should be given during hospital stay and at the time of discharge regarding exclusive breastfeeding, warmth, hygienic measures and immunization. Danger signs related to childhood illnesses should be explained to the mother and family members. Preventive measures against various child health problems like ARI and diarrhea should be informed. Then care of the family. Illness and hospitalization are often critical events that a child is faced, and the stress of it can affect all the family members. Maternal stress and anxiety can also affect the child in 2 ways. Transferring stress to the child and interfering with the mother's ability of child care. Many aspects of the parent's life will change during hospital stay, including their natural needs, social and economic issues, which can cause stress and anxiety for the parents. Then, feeling of stress and anxiety are often associated with the lack of information of disease and medical procedures, unfamiliarity with the hospital rules and regulations, unfriendly staff and being afraid of asking questions. It is the nurse's responsibility to provide care to the family during their hospital stay by aware the family about the hospital policies and a staffing pattern. Allow the parents to taking care of their child. This promotes the bonding process. Give positive feedback to the parents when they need the assistance of the nurses. Assess the family situation regularly. Nurses should provide supportive environment, provide support in decision making. Be available to the family when they need assistance. Nurses should strengthen the coping abilities of the family members. Whatever the information they need, the nurse should be available to provide about the child's health. Help the family to be involved in various organizations which provide financial assistance to the child during their course of treatment, so that financial support will be provided. It is all about the today's lecture. I hope you have clear with this. If you feel any kind of difficulty, kindly inform me. I feel very happy to help you.